Angelica Spurb.
Welcome everybody to Spurbs Herbs episode 70. Today we are going to be talking about an interesting formula, Ji Xiao Du Yin, universal benefit drink to eliminate toxin. I, as always, am your host, Dr. Greg Sperber. Without further ado, let's get into it. Today we'll be looking at another traditional Chinese formula, the Ji Xiao Du Yin, or universal benefit drink to eliminate toxin. This is not so commonly used, at least in my experience. It's an important formula, but it's not super commonly used, though maybe it might have been useful. It wasn't one of the common ones used for COVID, but it's in the ballpark with appropriate signs and symptoms. So not so commonly used, at least in my experience, formula for treating illnesses and epidemics, especially something called acute massive febrile disorder of the head. Could this formula be of help in COVID or maybe some other infections? Join us as we find out. And as usual, we will be adding something a little different. We are going to do a dive into interpreting clinical research and put a Chinese medicine spin on it. Please stay tuned. It's going to be another good one. Before we get into that, did you know that I have written a couple of books? The first book is called Integrative Pharmacology, combining modern pharmacology with integrative medicine. It's a big textbook. This is a pretty thorough book discussing pharmaceuticals, what they are used for, how they work, and how they may interact with other drugs, herbs, and supplements. It is the perfect reference book for all acupuncturists, herbalists, chiropractors, naturopaths, and really any integrative practitioner. But it is also perfect for anyone. It goes in depth, but it is easy to read and has difficult terminology bolded with definitions on the same page. This is not only a great book explaining pharmaceuticals, it is also available at an amazing price. It is available for 10% off its regular price, and you get it signed by me, the author, for just $67.45. Let's continue. My second book, written with an amazing insurance expert, Tiffany Anderson Hefner, is called Playing the Game, a step-by-step approach to accepting insurance as an acupuncturist. This is the perfect book for any acupuncturist who wants to or is contemplating accepting insurance. It gives step-by-step advice at every part of the insurance game, from getting set up through the patient encounter and, of course, getting paid. All in easy-to-digest language, honest advice, and lots of hand-holding through the process. And you guessed it, it also is 10% off and signed by one of the authors, me. All of this for $26.98. You can get either or both of these books at the shop at www.spurbsherbs.com. That's the podcast you're listening to, Spurbs Herbs, SPERBSHERBS.com. We got a lot to do today, so I'm going to get into things. This is a jam-packed podcast. So today, as something a little different, we're going to discuss interpreting Chinese medical research. There's a lot of research out there about acupuncture and Chinese herbs. Some of it is amazing, can inform our use of these modalities and make us better practitioners and just patients. Other research is dreck, just to be honest, and can make it difficult to help ourselves or our patients or give us incorrect info. However, it is not hard to separate the good from the bad. We are going to discuss some approaches based on my webinar, Interpreting Chinese Medical Research, available through Net of Knowledge. It's netofknowledge.com. While there are lots of different aspects to good research, I need to, when putting together these podcasts and my webinars, rapidly assess whether a particular study has merit or is pretty bad. To that, I have created a 5-step process which I will outline for you right now. That 5-step process: step 1, assess the type of study. Step 2, determine number of subjects. 3, was there a calculated p-value? 4, look up the impact factor of the journal. And 5, look at the study's methods. Let's look at each of these steps. Step 1, type of study. The first thing I always assess when looking at a clinical research article is what type of study it is described. Now, first of all, right there, that little bullet point is jam-packed. we're talking about clinical research articles. In other words, is there a clinical aspect? We're not talking about basic science. We're not talking about things in test tubes. We're really, I mean, we are, but we're not. We're really talking about, does this have clinical application? That's the important part. There is a hierarchy of types of research useful for making clinical decisions for humans. At the lowest end is in vitro and animal research. In vitro literally means in glass. It's Latin for in glass and refers to research done in the laboratory and does not involve a live human or animal. Animal research may or may not apply to humans and is likewise of low use clinically. It's not useless, it's just low use clinically. Just because something happens in a pig, a rat, a rabbit, a dog, doesn't mean the same thing's going to happen in humans. Next up the hierarchy, there is individual or small group case studies showing some clinical effect of an intervention in one or a handful of cases. As the hierarchy climbs up the evidence ladder, it looks at types of research like case control and cohort studies, and then ultimately systematic reviews of multiples of these studies. The most respected form of research is a randomly controlled trial, or RCT, and the best evidence of all is a systematic review of many RCTs, or randomly controlled trials. And by the way, a randomly controlled trial is important, but it's also, what ideally we want is a placebo-controlled, randomly controlled trial, so that there's a placebo involved as well. Basically, many studies all the way up to small RCTs may be completely reversed when looked at with a large and well-constructed RCT, or randomly controlled trial. So while animal, in vitro, case, and cohort studies may be fascinating and lead to something really cool, I personally don't give them much credence in my clinical decisions. Though, in the absence of any other evidence, I may employ them clinically. So I'm not eliminating them as a possibility, but I know they're low evidence and they may or may not be relevant. Step 2 is the number of subjects. So once I have a good idea of the study I am looking at, I look at how many subjects were involved. Basically, the larger the study, the more power the study has, and more is always better. In general, 30 to 40 people means, number of subjects, so 30 to 40 subjects means the study is statistically relevant, but still small. Smaller than that has very little bearing on a large population and is probably not clinically relevant. In other words, under 30 to 40, no statistics can really apply to it. Population statistics can apply to it, and it doesn't have any real clinical relevance. In our field, when getting into hundreds and definitely thousands, we start to see some useful info. So that's what we're looking for. And it is, when I go through my podcast, when I talk about research, I will always have the N value behind it. N is number of subjects. So I'll say N is 40, N is 50. You'll see that on, if you're looking at the PowerPoints. If not, I mention it as I'm reading them, but it's really important to look at those number values of patients. Step 3 is the p-value. So the number of subjects, by the way, this is cursory. There's a lot more to each of these points as we go along, but I'm trying to give an overview of this. So the number of subjects also affects another number usually reported in a study, the p-value. This is a statistical number showing the likelihood that the results are significant. If the p-value is under 0.05, then the study shows some valid results. When it gets to 0.01 or even 0.005, it is a really well-powered study that shows significant results. If it is above 0.05, it is not considered a strong study, whether that is because it is not sufficiently powered, the hypothesis is not true, or some other issue. One needs to look at the study. Now, in a nutshell, this 0.05 that we're looking at is basically saying there's a 5% chance that this is not true. That's really what that 0.05. So you go to a 0.01, there's a 1% chance that it's not true, and even lower from there. So basically, for it to be considered a good study, it has to show that only 5% is probably wrong. The study is wrong at a 5% level. That's a pretty high bar for a study to get to. Lots of them do that, but that's the thing. So that's step 3, p-value. Step 4 is the impact factor. Looking up the impact factor of a journal is probably crucial in today's era of the internet. Anyone can say, quote, they are published, unquote, by paying for inclusion in a journal or submitting to a journal of very low regard. Most journals aimed at our field are not highly regarded, but good research will be in other, more highly regarded journals. The importance of a particular impact factor depends on the field. Some fields have higher average impact factor than others. Basically, the top 10% of journals have an impact factor of over 4.0. Frankly, in our field, an impact factor of over 2.0, I say here is pretty good. It's really good to be over 2.0. So that's what you can do. And it's easy to find out what the impact factor is. All you have to do is put the journal name into Google or whatever, search engine you're using and put impact factor. So, and then it will pop right up. It will be off in the sidebar. It'll give you the impact factor immediately. It does change year to year. So get the latest one possible. Usually they lag by a year or two. But that's all you need to do. They don't change that much from year to year, so it's not a huge deal. So the next step is step 5, or the methods. I was told early in my career to always read the methods portion of a study first. Well, I still pretty much read the abstract first to see if it is relevant to what I am looking for, and then I will read the methods section. In our field, this can tell us a lot. A list of questions that flows through my head when reading this section include, is this study randomly controlled? What is the control? What were the inclusion and exclusion criteria? Is the prescription either herbal or acupuncture fixed, or does it change per patient? And if it changes, how did they do that? So, that may sound a little bit as a weird question, but it's actually a really important question in Chinese medicine, because we have, for any given Western disease, so let's say the cold is a great example, we might have 5 or 6 different diagnoses for the cold. In the case of a cold, we have when heat, when cold, when damp, when dry. There's a few others as well. So at least 4 relatively common ones that are completely different and treated completely differently. So having different prescriptions is not a bad thing. How you deal with that in a study is not easy. So I always am curious about the methods when that happens. And finally, another question I have, and there's other questions that go through my mind, but these are the big ones. Does the acupuncture prescription make sense? Many, many times I'll see a point prescription. I'm like, that makes no sense whatsoever. And you can tell, like, sometimes there are people who are doing an acupuncture study who don't know acupuncture, and they're just pulling from literature and like other studies, and it makes no sense why they're choosing the points they're doing. And then other times you can see an acupuncture was clearly involved in a study, and like, okay, that makes perfect sense. So, and then sometimes I go, okay, this makes no sense. Is there something I'm missing? Is something I'm not familiar with? And then I'm curious why you can usually find out why they chose, sometimes, not always, but you can find out why they chose that. And that's helpful for me. So with these questions and each of these 5 steps, I have a good basis to determine how strong the study is and whether I should give it some credence. So that's a brief introduction into research. With that, let's get into today's herb. So today, as I said herb, but herbal formula. Today we're talking about Ji Xiao Du Yin, which is translated as Universal Benefit Drink to Eliminate Toxin. And usually under they have the titles of these, there's a little paragraph or a couple sentences of blurb about it. And here's what that says in Scheid. Remember, we have 2 major textbooks for the formulas. We have Scheid and his team, and we have Chen and Chen. So Scheid says, this formula devised during a period of widespread epidemics in China was considered by its author to be a well-tested formula that could save many lives, hence the name. Other names include Ji Xiao Du Yin. So again, this is the exact same formula, same pronunciation. It's actually Ji Xiao Du Yin, but it's done in Wade Giles. So it's spelled instead of P-U-J-I, it's C-H-I. Instead of X-I-A-O, it's H-S-I-A-O. Instead of D-U, it's T-U. So just same pronunciation, just a slightly different way of making Roman letters. Universal Salvation Detoxifying Drink, everyone's detoxifying decoction, scute and simicifuga combination, which is interesting because that's not the chief ingredients according to Scheid, but there you go. This formula is in the subcategory of formulas that clear heat and resolve toxicity under the category of formulas that clear heat, under the category of formulas that clear heat. So there's several subcategories under clear heat. This one's clear heat and resolve toxicity according to Scheid. Chen Chen are very similar and places it in the subcategory of heat clearing and toxin eliminating formulas under the category of heat clearing formulas. Now, this toxin thing is a really important thing. I have a thing about toxins. I've talked about it on a previous Spurbs Herbs. I think there's a lot of people saying, oh, we got toxins in the environment, we got toxins in our houses, we have to eliminate toxins every which way. And I think that's ridiculous. I don't know what they're talking about. I know there's chemicals in this stuff, but that doesn't mean there's toxins. That isn't what I would consider a toxin in the body. For most of these exogenous toxins can deal with it just fine. That isn't the toxin that we're talking about here. It's very specific with Chinese medicine. We're going to get into what that is in just a little bit. But before we do that, let's talk about the formulas that clear heat in general. Scheid is very good at describing the overall categories and subcategories. And so he has a great introduction to formulas that clear heat. And these are excerpts from that. So the treatment strategies presented by the formulas in this category were first mentioned in the following passages from Basic Questions. When they say Basic Questions, they mean the Huangdi Neijing Su Wen, which is one portion of the Yellow Emperor's Classic of Internal Medicine, which is one of the oldest existing books on medicine, and definitely the oldest existing book in Chinese medicine that's out there, about 200 or 300 BCE. So in that Basic Questions, cool what is hot and use cold substances for hot causes. That's in chapter 74. Use clearing to treat warmth and use cold substances to treat heat. That's chapter 70. Same idea is echoed in the Divine Husbandman's Classic of the Materia Medica. We talk about this book a lot, and we are going to talk about it not in this episode, but the next episode. It's the earliest book on single Chinese herbs. Again, instead of 200 BCE, this is about 200 CE. So about 400 years after that, the Huangdi Neijing Su Wen. So in that book, there's a quote that says, use cold medicines to treat heat. Among the 8 methods of treatment, the formulas in this category utilize the clearing method, or Qing Fu. In its broadest sense, clearing heat implies a process of purification and transformation that restores coolness and freshness to the body. The term is used to distinguish the strategy from others that address heat. The most important of these are purging, which treats the accumulation or clumping of heat in the interior, and the venting of heat carried out by formulas that release the exterior and dispel wind heat. Heat clearing formulas are used for all those problems where heat is present in the interior, but there are no signs of internal clumping that would imply a mixing of heat with body substances like fluids, phlegm, or stagnant food. Many modern textbooks thus refer to the former as heat without form, or wuxing zhi, and to the latter as heat with form, or youxing zhi. In a more narrow sense, clearing heat can be differentiated from draining fire, xie huo. Clearing removes the heat from the qi or blood levels without impeding their movement and transformation. By contrast, draining fire directs the fire downward and removes it from the body via the urine and bowels. In traditional Chinese medicine, the words warmth, heat, and fire are often used interchangeably. The difference among them is one of degree and manifestation. Warmth is less intense than heat, while fire is more intense. Warmth and heat are terms that are more often applied to external pathogens, while fire is used to designate heat within specific organs. Fire is also used to describe conditions with grossly visible manifestations of heat, such as bleeding. Yes, in Chinese medicine, bleeding can be one of the manifestations of heat. So bleeding, flushed face, and red eyes, even when the systemic level of heat is not particularly severe. Before prescribing heat-clearing formulas, it is important to ascertain that there is no heat in the exterior and no clumping of heat in the interior. Should there be, one must clear the heat from the exterior or purge it, or use one of these strategies in conjunction with that of clearing heat. It's also important to clearly distinguish whether the condition is deficient or excessive in nature, and to identify the location, level, and organ of the disorder. Failure to do so will bring minimal results at best and may lead to complications. Most of the herbs in these formulas are cold in nature. Cold substances readily injure the yang qi and produce cold. To avoid these side effects, it is important to include ingredients that protect the functions of the stomach. Most of these formulas are designed for treating relatively acute disorders. Their use should be discontinued once the heat has been successfully treated. It is also important to take the patient's overall condition or constitution into account. For example, great care must be exercised in treating a patient with long-standing yang deficiency who contracts a warm heat pathogen disease. In this case, the cold ingredients in this formula must be used with utmost caution in order to prevent the further injury to the yang. It's also essential to avoid mistaking the presence of false heat in patients with interior cold as a sign of excess heat. In that case, warming the interior will lead the floating fire back to its source. So this false heat and true heat is a really kind of complicated concept in Chinese medicine, which we're not going to get into right now, but I wanted to highlight that it's actually an important concept with someone, and you want to definitely, these are for treating true heat, not false heat. Back to Scheid and his team, if the use of heat clearing formulas does not bring the desired effect, this is most likely due to deficiency of true yin. As described by Wang Bing, the Tang Dynasty editor of the Inner Classic, where the use of cold herbs and formulas does not produce cold, this is due to a lack of water. In such cases, enriching the yin and fortifying the water will clear the heat and reduce the fever. Some patients with vigorous, blazing heat will vomit up orally administered heat clearing formulas. Should this occur, the addition of a small amount of ginger juice or simply letting the decoction cool before taking it will usually alleviate the problem. So that's their introduction to formulas that clear heat. And then they have an introduction into formulas that clear heat and resolve toxicity. So this is the subcategory that we're talking about today. So they continue to describe the subcategory. The formulas in this section are used in treating heat toxin with vigorous heat in the three burners, characterized by fever, irritability, incoherent speech, nausea or vomiting, nosebleed, rashes, or various types of sores. Toxin is generally distinguished from heat by the presence of pustular lesions such as sores, or by the general sickness of the patient. These formulas focus on heat toxin in the middle and upper burners, which may develop from constrained pathogenic influences generating heat, the accumulation of heat in the chest and diaphragm, or wind heat epidemic toxin attacking the head or face, which is specifically what our formula today does. In addition, formulas that treat toxic sores characterized by localized redness, swelling, pain, and malaise are included. The word toxin, or do, so I told you we were going to get into toxin, can mean different things depending on the context. It may refer to the cause of a disease, the pathological mechanism of a disease, or the toxicity of a substance, and is sometimes used interchangeably with the term for pathogenic influence or xie. In this chapter, toxin refers to the etiology or clinical presentation, not the toxicity of a substance. Chinese medicine also differentiates between yin and yang toxins, a distinction that dates back to chapter 3 of Essentials from the Golden Cabinet. So Essentials from the Golden Cabinet, again, is a very early, it's the earliest book, along with the Shanghan Lung, is the earliest book on formulas. So that is early in Chinese medicine as well. In general, yin toxin refers to toxicity accompanied by signs of cold, such as a pale or white complexion, white pus, or fatigue. Yang toxin refers to toxicity that manifests purely as heat. The formulas in this section address yang toxin. As heat toxicity is often constrained and clumped in the upper or superficial parts of the body, herbs that disperse wind and raise upward are often added. When heat toxicity clumps in the middle burner, it can lead to constipation. Heat toxicity can clog up and collect, leading to local swelling and firmness, such as abscesses or boils. These abscesses and other swellings can be extremely painful. Herbs that invigorate the blood and stop pain will then be necessary. So that is an introduction to the formulas that clear heat and resolve toxicity. Let's get back to our formula and what this formula specifically does as we talk about Chinese medical actions of this formula. So according to Scheid and his team, they say this formula clears heat, eliminates fire toxin, and disperses wind heat. Chen say it clears heat and eliminates toxin as one function and dispels wind and disperses pathogenic factors as another function. So in other words, they're very, very similar, which often happens, but not always. So let's talk about the Chinese medical indicators. So we have the uses. Now let's get into the actions. Let's get into the indications. So Scheid et al. Say this formula can be used for strong fever and chills, redness, swelling, and burning pain of the head and face, inability to open the eyes, dysfunction of the throat, dryness and thirst, a red tongue with a powdery white or yellow coating, and a floating, rapid, and forceful pulse. This is acute, massive, febrile disorder of the head, da to wen, also known as massive epidemic disorder of the head, da to tianxing, due to a seasonal epidemic toxin associated with wind heat and damp phlegm. It is most commonly seen in children and is usually contracted during the winter or spring. It is characterized by a sudden onset and severe fire toxin. It is the severity and rapaciousness of the effects on the body of the underlying pathogenic influences that account for the use of the word toxin. Chen say this formula can be used to treat da to wen or swollen head epidemic with the presence of wind, heat, and toxin in the upper jiao or upper burner and head, redness, swelling, and pain of the face and head, red and swollen eyes, difficulty in opening the eyes, fever, aversion to cold, a sore throat, thirst, dry red tongue with a yellow tongue coating, and a rapid, forceful pulse. So that's an introduction to what this formula does. Let's talk a little bit about the history here. So this is one of those herbs or herbal formulas where there's a discrepancy between our two main texts for formulas. Or is there? Scheid et al. Says its source is Dong Yuan's tried and tested formulas, which is Dong Yuan Shi Xiao Feng, written in 1202 by Li Gao or Li Dong Yuan, same name. Meanwhile, Chen say it was first mentioned in 1266, so 64 years later, by Dong Heng Shi Xiao Feng, or tested effective formulas by Dong Heng, by Li Gao, also known as Li Dong Heng. So same book, 64 years difference. Well, maybe these aren't different sources, but why the discrepancies? First, Li Gao, Li Dong Yuan, and Li Dong Heng are all the same person. The English names seem to be a translational issues between the names of the texts. I did see different sources with these dates. However, Li Gao passed in 1251. So unless the book was published posthumously, which it could have been, I tend to believe 1202 is probably the more accurate date for this. But it does seem like we're talking about the same book in the 13th century at some point. So now we get into the ingredients. This is an incredibly large formula, very large formula. So we're going to talk about all the ingredients. We're going to get into them, but some of them we're not going to get too far into them. So this condition requires two strategies: resolving the fire toxicity, the primary treatment principle that deals with the branch. So in Chinese medicine, we talk about root and branch treatments. So the branch are the symptoms, signs and symptoms, and dispersing wind heat, the secondary principle that deals with the root. So what's the underlying cause of those signs and symptoms is the root. So root and branch treatment, both of them are done by this formula. And because of these two strategies, we kind of stratify some of the ingredients as we go along. So that's why we mentioned this as we were talking about ingredients. So the first ingredient is Scutellaria radix or Huang Qin. We want 15 grams in this formula. This comes from herbs that clear heat and dry dampness, very important herb in that category. This herb clears heat and dries dampness, resolves toxicity. This is a toxic formula, so it makes sense. A formula to treat toxicity. Stops bleeding and calms the fetus and sedates ascendant liver yang. Thus, this is, along with Coptis rhizoma huanglian, one of the two chief herbs. A relatively large dose of these herbs is used to clear and drain the toxic heat from the upper burner. So we just mentioned huanglian. Let's talk about that. That's Coptis rhizoma. Again, we're using 15 grams. 15 grams of both of these are large doses, especially for huanglian. Generally, we use a little bit lower dose of huanglian. So this is a very large dose of that. And they're both in the same category of herbs that clear heat and dry dampness. And the functions of huanglian are clears heat and dries dampness, drains fire and resolves fire toxicity, clears heat and stops bleeding, and clears heat topically. So all those could be very useful here. Our third ingredient is ginseng radix or renshen, which is ginseng. And if you can see the pictures, I'm showing a picture of white ginseng on the top and red ginseng on the bottom. And this comes from the category of herbs that tonify the qi. So it's an interesting, you're going to see this is kind of a controversial ingredient as we get into the commentary of this formula. So according to Bensky et al., which is one of our main texts for single herbs, renshen has the following actions: powerfully tonifies the primal qi, strengthens the spleen and tonifies strengthens the spleen and tonifies the stomach, tonifies the lungs and augments the qi, generates fluids and stops thirst, benefits the heart qi, and calms the spirit. Chen say, in this formula, renshen tonifies qi and prevents the bitter and cold heat-clearing herbs from damaging the body. Our next herb is Arctii fructus or Niobangza. We're using only 3 grams. That's a small dose of this. It's from the cool, acrid herbs that release the exterior. According to Bensky and his team, Niobangza disperses wind heat and benefits the throat, disperses wind heat and benefits and moistens the intestines. Sorry, there's a duplicate line there. This formula has 2 groups of deputies based on the 2 strategies mentioned earlier. Acrid and cool Niobangza, Forsythia fructus lian chow, and Menthe haplocalcisus herba, which is bohe, that's field mint, along with acrid and neutral bombyx batricicatus, or baijiangsan. That is actually really interesting. That is, we're going to see what it is, but it's I want to say it's not flying squirrel, it's silkworm. I am totally blanking on it for some reason. So disperse all of these herbs, disperse wind heat from the upper burner, head, and face. And they're all a group of deputies. So that's a lot of deputies for this formula. So here are those deputies. We have Forsythia fructus, lian chow, only 3 grams. Again, that's a relatively small dose of these herbs. And it is in our single herb category of our formula, which is herbs that clear heat and resolve toxicity. And according to Bensky, lian chow clears heat and resolves toxicity and reduces abscesses and dissipates clumps. We're using Menthe haplocalcisus herba or bohe. Again, only 3 grams. These are small doses of these herbs. Cool acrid herbs that release the exterior is the category that's in. And traditionally, it clears and benefits the head, eyes, and throat, vents rashes, and courses the liver and moves qi. Then we have dry fried bombyx batricicatus or chow jiangsan. And we're only using 2 grams, but according to Chen and Chen, they actually put in, for some reason I don't understand this, 2.1 grams. I don't know why there's 0.1 grams, why there's a discrepancy there. And they don't say it's dry fried, so it's just straight jiangsan. And this is in an interesting category, especially for what we're talking about here. This is in a category of herbs called substances that extinguish wind and stop tremors. It's a very interesting herb to throw in here. So according to Bensky, Jiangsan extinguishes wind and stops spasms and convulsions, extinguishes wind and stops spasms and convulsions, dispels wind, disperses wind heat and stops itching and pain, and expels wind and stops itching for itching skin lesions such as wind rash. So we can see why this might be useful with the wind heat, even with some of the itching of the face and stuff. So you can kind of see why it's there, but it's an interesting addition to this formula. Our next herb is Scrophularia radix or Xuanshen. We're using 6 grams here, and this is in the category of herbs that cool the blood. So we're still in cooling here, but now we're kind of cooling the blood a little bit. So according to Bensky and his team, Xuanshen clears heat and cools the blood, nourishes the yin, and softens hardness and dissipates nodules. So now we're getting into another set of deputies here, and that set includes this Xuanshen. It also includes Lasiosifera or slash Calvadia or Mabo, Isatis slash Baphicacanthus radix or Balanggen, Platycody radix, Jiegong, and Glycericerae radix, Gansauer, licorice, that's licorice. Clear heat from the throat and relieve the toxic fire there. So that's where this next set of deputies is coming from. So getting into that grouping, our next one is Lasiosifera slash Calvatia. Mabo is an important herb, but it's one that I learned late. For some reason, it just didn't settle in. And anyways, 3 grams. Herbs, and I haven't heard this Latin before. This is new to me. So herbs that clear heat, and that happened with the new edition of the herbal book from what I actually studied from it in school. So herbs that clear heat and resolve toxicity. So same herbal category as we're talking about this formula. According to Bensky, Mabo clears the lungs, resolves fire toxicity, and improves the condition of the throat and stops bleeding. So it seems pretty relevant for our formula here. Isatis slash Baphicacanthus radix, Balanggen. This is actually one of my favorite herbs from this herbal category of herbs that clear heat and resolve toxicity. We're using 3 grams of this. Again, relatively low dose. According to Bensky and his team, Balanggen drains heat, resolves fire toxicity, cools the blood, and benefits the throat. Platycody radix or Jiegong, 6 grams, which is a normal dose. Warm herb that transforms cold phlegm. Opens up and disseminates the lung qi, dispels phlegm and benefits the throat, pushes out pus, and opens up and raises the lung qi while also directing the actions of other herbs to the upper regions of the body. And I believe the last one in this set of deputies is Glycericerae radix or Gansau. We're using 6 grams of that, which is, a normal dose, though we often, if it's not part of the formula, which this clearly is like there to harmonize, we might use a slightly lower dose, but 6 grams is a good dose. And this is in our herbs that tonify qi. So we have 2 herbs that tonify the qi. We have the renshen and we have the licorice here. Traditionally, this tonifies the spleen and augments the qi, moistens the lungs and stops coughs, moderates spasms and alleviates pain, moderates and harmonizes the characteristics of other herbs. Our next herb, and we're kind of out of those deputy herbs that we've been talking about. Next herb is Citri reticulata exocarpium rubrum or Juhong, and we're using 6 grams of this. Chen actually use Chen Pi instead, which is a common substitution for Juhong. Juhong is great and all. Chen Pi has often supplemented that in modern herbology. But here traditionally Juhong is used, and this is in the category, both of them are in the category of herbs that regulate the qi. So used primarily for vomiting and belching and for treating phlegm damp coughs. This assistant in this formula regulates the qi to ensure the free flow of blood and qi and thereby prevent the pathogenic influences from accumulating. This helps to reduce toxic swelling. It also helps the stomach a little bit, so it's not a bad herb to protect that a little bit, as we mentioned earlier. Our next herb is Bupleuria radix or Chai Hu, 3 grams. Again, smaller end of the dose, but not outside of normal. And this is from the cool acrid herbs that release the exterior. And traditionally, this resolves lesser yang disorders and reduces fever, spreads liver qi and relieves constraint, and raises and lifts the yang qi, specifically the clear qi of the stomach and gallbladder. Chaihu and Simisafuga rhizoma shengma serve as envoys by raising the yang, dispersing wind heat, and conducting the other ingredients to the head. They are also effective in dispersing stagnation due to fire. So that's why those two assistants envoys are included in the formula. So let's talk about that other one, Simisafuga rhizoma, or shengma. Here we're using 2 grams, and again, Chen say 2.1 grams. So I know why they're doing that, because the way herbs are traditionally measured, it's usually by 0.3 or 3 grams. And so that's why they're doing 2.1 grams here, but I think a lot would just round it down to 2 grams, as Shai did. Okay, so 2 grams of Simisafuga rhizoma shengma, and this is in the cool acrid herbs that release the exterior. According to Bensky, shengma discharges exterior conditions and vents measles, clears heat and resolves toxicity, and raises the yang and lifts what has sunken. So that is our ingredients. Let's get into the preparation of this formula. So Scheid and his team say the source text advises to grind the ingredients into powder and take half as a draft and the other half in the form of pills made with honey that are slowly dissolved in the mouth. At present, it is generally prepared as a decoction with ginseng, radix, renshen, either reduced to a dosage of 3 grams or deleted. And we'll see in the commentary why it might be deleted. Chen and Chen say the source text states to grind the ingredients into powder, cook it in water, take the warm decoction frequently in small amounts. It may also be formed into pills with honey and dissolved under the tongue before swallowing. For patients with constipation, add Da Huang or radix et rhizoma ray. Today, this formula may be prepared as a decoction with 3 grams renshen or radix et rhizoma ginseng. And they have a note. One variation of this formula contains 6 grams of boha, yerba menthe, and omits renshen, radix et rhizoma ginseng. So there you go. You can, add more of the mint and take away the ginseng completely. So let's get into the commentary. As usual, Scheid has an amazing commentary on this formula. So although early observations of this order were recorded in the Yellow Emperor's Inner Classic, the understanding of its etiology and pathogenesis became more sophisticated during the Jin and Yuan dynasties, and perhaps was even better understood by the warm pathogen disease current of the Qing dynasty. If you're not familiar with the dynasties, this is often how history in China is kind of referred to as dynastic. So the Qing dynasty was relatively late. It was just before the fall of all the dynasties, if I remember correctly, and the Jin Yuan were earlier than that, quite a bit earlier. Therefore, the Chinese medical literature discusses the disorder under a range of different names. Most writers, however, agree that Li Dong Yuan's formula constitutes the treatment of choice. This consensus is reflected in a passage from Wu Ju Tang's Systematic Differentiation of Warm Pathogen Diseases, or Wenping Tao Bian, written in 1798. Treatment strategies for this disorder cannot go beyond Li Dong Yuan's universal benefit drink to eliminate toxin, or Ji Xiao Du Yin. Nevertheless, Wu Ju Tang felt entitled to make major adjustments to the use of the formula in the clinic. Noting that the inherent momentum of the disorder involved the excessive accumulation of heat toxin in the upper body and head, he suggested removing Bupleuria radix Chaihu and Simisafuga rhizoma shengma and replacing them with Lanicera floss Jinyan Hua and Schizonipidae herba Jingzhe. He argued that the addition of these light substances ensured that the formula would focus on the upper burner and head with little risk of guiding even more qi to this area. Such reasoning reflects a fundamental difference in style between Li Dong Yuan's emphasis on supporting the body's normal qi and Wu Ju Tang's adherence to the principles of the warm pathogen disease current, with its emphasis on the use of light substances to eliminate serious disorders. If the latter approach tries to prevent newly contracted pathogens from moving deeper into the body, the Jin Yuan medicine that Li Dong Yuan represents concentrates instead on supporting the body's resistance. These concerns not only underpin the use of Simisafiga rhizoma or Shengma and Bupleury radix Chai Hu, which are intended to facilitate the ascent of yang qi, but also explain the inclusion of a tonifying herb like ginseng radix Ren Shen in a formula intended to resolve toxicity and clear heat. The contemporary consensus is to include ginseng radix Ren Shen only if the patient's constitution or presentation demands it. No such consensus exists regarding the use of Simisafiga rhizoma Shengma and Bupleury radix Chai Hu. Those advocating inclusion refer to the well-established treatment strategy of discharging heat from constraint. They also point out the synergistic effects that arise from the combination of Coptis rhizoma Huanglian and Scutellaria radix Huangqin. Because these herbs drain fire downward, their matching balances out any excessive ascending or downward directing effect that each pairing might cause on its own. In other words, the Huanglian and the Huangqin drain down, the Chai Hu and the Shengma move up, and so they're opposite directions. And we see this a lot in Chinese formulas that will use opposite directions to balance and sometimes to regulate what's going on. Proponents of the warm pathogen disease therapeutics, such as the Qing dynasty physician Ye Lin, replied that such rationalizations cannot make up for Li Dongyuan's basic mistake. His own compromise was to omit Coptis rhizoma Huanglian and Simisafiga rhizoma Shengma, but retain Scutellaria radix Huangqin and Bupleury radix Chai Hu. This argument, in turn, is based on Ye's own understanding of warm pathogen disorders as arising from lurking pathogens, or Fuxie. According to the doctrines laid out in supplemental critical annotations to the systematic discussion of warm pathogen diseases, or the Zeng Bu Ping Ju Wen Bing Tao Bian, written in the mid-19th century, these lurking pathogens usually vent through the lesser yang and therefore justify the use of Bupleury radix Chai Hu and Scutellaria radix Huangqin. So that is the commentary from Scheid. Chen has a very small commentary. They add some interesting commentary. Ji Xiao Du Yin is one of the best herbal antibiotic formulas to treat infectious and contagious diseases. The name Ji Xiao Du Yin literally means universal benefit decoction to eliminate toxin, which implies that this formula treats everyone, universal benefit, with infectious diseases, heat, and toxin. So they obviously advocate a much broader use of this formula, I think. There are some modifications for this formula. Several are discussed in Scheid. For constipation, add Ray radix at rhizoma da Wang. We mentioned that earlier under preparation. Chen recommended the same thing. For more obvious exterior symptoms with less severe internal heat, reduce the dosage of Scutellaria radix Huangqin and Coptis rhizoma Huanglian, and add Schizonipidae herba Jingjie, Sapashnacovia radix Feng Feng, Menthe haplocalicis herba Bohe, and Morifolium Sangye. So there's already Bohe in this formula, but you would probably increase the dosage a little bit to that. When the exterior symptoms have disappeared and the internal heat is severe, remove Bupleury radix Chai Hu and Menthe haplocalicis herba Bohe and add Linicerae floss Jinyan Hua and Indigo naturalis or Qing Dai. So basically, you're taking out some of the exterior cooling and exterior relieving herbs and adding in more heat toxin herbs. For internal heat with constipation, add radix at rhizoma da Huang, Auranti fructus immaturus or Zhi, and Natrii sulfus cicatus Shuangming Fun. For hard, stubborn, localized swelling, add Mutan cortex or Mudan P, Paeonia radix ruba or Chi Shao. Red peony, Frutillaria thunbergi bulbus Ja Bei Mu, Prunelle spica or Shaku Sao, and Lufe fructus retinervis. I haven't seen that before in Latin. Sigua luo. I mean, I know the herb, I just haven't heard that Latin appendage. Chen have numerous modifications we will not discuss due to time constraints. Timing's going well, though. We're good. So let's talk about comparisons of formulas here. Scheid compares today's formula with 3 other formulas. However, we'll only discuss one comparison as appears in both Scheid et al. And Chen. And that is for the Immortals formula for sustaining life, or Xiangfang Huo Ming Yin. Both formulas clear heat and resolve toxicity. However, in the case of massive epidemic disorders of heat treated by universal benefit drink to eliminate toxin, Ji Xiao Du Yin, wind heat epidemic pathogens enter the body via the exterior and upper burner, and toxic heat is located entirely in the upper part of the body. Thus, the secondary principle of treatment for this formula is to disperse wind heat from the exterior by enabling the ascent of yang qi. By contrast, a mortal's formula for sustaining life, Xiang Fang Huo Ming Yin, treats toxic heat caused by stasis of blood and stagnation of qi, with heat arising as a secondary consequence. Thus, it focuses on moving the qi, invigorating the blood, transforming phlegm, and reducing swelling. Chen Chen say Ji Xiao Du Yin and Xiang Fang Huo Ming Yin, sublime, they call it sublime formula for sustaining life. Both clear heat and eliminate toxin. Ji Xiao Du Yin treats toxic heat affecting the upper jaw, manifesting symptoms such as redness, swelling, and pain in the face, difficulty in opening the eyes, a sore throat, thirst, and fever. It disperses wind heat as well as toxin lodged in the head. Xianfang Huo Ming Yin clears heat and eliminates toxin. It also moves qi and blood to eradicate nodules, swellings, carbuncles, and sores. Okay, that was commentary. Thank you. And comparisons and all that. It was a lot of stuff. So let's talk about the biomedical indications for this formula. Scheid et al. Say, with the appropriate presentation, this formula may be used to treat a variety of biomedically defined disorders, primarily acute infections, including furuncles and carbuncles, especially affecting the head, parotiditis, that's inflammation and infection of the parotid glands, tonsillitis, lymphadenitis, infection / inflammation of the lymph nodes, upper respiratory tract infections, primarily in children, hemorrhagic, meaning that there's blood, conjunctivitis, bleeding, hemorrhagic is bleeding, conjunctivitis, acute icteric hepatitis. Icteric means there's jaundice involved. Infectious mononucleosis accompanied by hepatomegaly or enlarged spleen, enlarged liver, and viral myocarditis, which is a viral infection of the myocardium or the heart. That is not a good thing to have. Chen Chen say it can be used to treat epidemic hemorrhagic fever, respiratory tract infection, common cold, influenza, severe sore throat, infectious and parotitis, acute tonsillitis, lymphadenitis, purulent inflammation and abscess of the face and head, erysipelas, which is a skin infection, herpes, carbuncles, boils, testitis, which I'm assuming is inflammation of the testes, myocarditis, and conjunctivitis. Science behind this. Chen Chen discussed studies with positive findings using Ji Xiao Du Yin or a modified version. These include epidemic hemorrhagic fever with an N, going back to that N we talked about earlier, the number of subjects, 435. So that's a large study. It doesn't mean it's a good study. It just means there's lots of people, and it could still be a poor study, but at least that gives us a good indication that there's some good info here, potentially some good info. So that's epidemic hemorrhagic fever, children with infectious parotitis with an N of 159. Again, not bad. And another study of the same thing with N equals 100. So there's a couple studies, decent studies there. Children with respiratory tract infections and high fever used a modified version of this formula. N is 35, so right on the cusp of being statistically valid. Acute viral myocarditis, again, a modified formula with N equals 48, so small. Acute suppurative tonsillitis, again, a modified formula, N equals 57, smallish. Acute conjunctivitis, N equals 306. But what it says is, I said N equals 306 subjects, but it actually is 306 quote unquote affected eyes. So I don't know if that's, it could be 2 eyes in one person. So potentially an N as little as about 153, or as much as 1 eye in everybody, or 306. So it's a little bit of an odd sort of N number there. And finally, in erysipelas, N equals 52. So again, a small study there. Drug-herb interactions in this formula. Several herbs in this formula may affect cytochrome P450 isozymes, are different types of cytochrome P450. These include Gansao or licorice, Huanglian, Huangqin, Renshen, Shengma, and Xuanshen. Now, I'm not getting into all the specifics of it because there's a lot of them. Some of them induced, some of them inhibited. So overall, there may be a little push-pull. So I don't know how massive the effects on cytochrome P450 is. I'd have to go into more depth than we have here today to figure that out. Gansao may increase blood pressure and fluid retention when used with oral contraceptives, as shown in 2 case studies and an uncontrolled human study. If you're reading this, it has a C in parentheses after that. It means C level evidence. It's in humans, still relatively low level. It only goes A, B, C, D. And the other thing I want to add here is Gansao may do all this, but in this formula, there's drain damp herbs, drain damp heat herbs, and draining damp is kind of considered an herbal diuretic, potentially, which would reduce blood pressure. So even though Gansao may increase blood pressure, other herbs in this formula are probably counteracting that. So I wouldn't be concerned about the increase of blood pressure from Gansao in this formula. Renshen increased the serum concentration of digoxin in a single case study. In one case study, Renshen was thought to decrease INR in a patient stabilized on warfarin. So we do need to have some concern with some of the heavier duty cardiac drugs with Renshen. Let's talk about concerns of this formula, and then we're going to wrap this up. We're right on time. So Scheid and his team have one concern about this formula. Because most of the herbs in this formula are bitter or acrid and have dispersing properties, it should be used with caution in treating those with yin deficiency. And Chen also have some cautions. Ji Xiao Du Yin should be used with caution in patients with deficiencies of yin or body fluids because this formula is bitter, cold, acrid, and dispersing in nature. Avoid foods that are pungent, spicy, oily, or greasy while taking this formula. And that's it. Time for a wrap-up summary. So that was today's formula, Ji Xiao Du Yin, a really interesting, useful, and historic formula for treating specific types of infection. This is what I love. So, I started this going, I'm not sure what this formula does. I don't use it. I've never seen it used. And I come out of this going, wow, this is actually a really important historical formula. And for a very specific sort of situation, it is incredibly important and probably, I would assume, very effective. I'm really glad I learned about this formula. We started today by discussing how to quickly assess clinical research. And then we got into the formula, including its ingredients, commentary, the science, and our concerns and cautions, as well as its potential drug interactions. All in all, another exploration of an interesting and useful Chinese formula. And like I said, I'm thankful. I learned so much from doing this, and I'm happy I get to pass it on a little bit too. In our next episode, in 2 weeks, we're going to be looking at another single Chinese herb, Ba Ji Tian, or Morinda root. In the Latin is Morindae officinalis radix, a yang tonifying herb which can also strengthen the sinews and expel wind dampness. As usual, we will explore all the intricacies of this herb as well as an explanation of its category. And as always, we will look at something a little different. Join us in 2 weeks for another interesting episode. And I'd like to thank you very much for listening. If you like this podcast, please do us a huge favor. Subscribe to our podcast in your favorite podcast app. Thank you. And remember, you can get CEUs, and that's continuing education units, and National Commission for National Certification Commission of Acupuncture and Oriental Medicine professional development activities at www.integrativemedicinecouncil.org. That's Integrative Medicine Council, COUNCIL.org. You can always get in touch with me at drgreg@spurbsherbs.com or at our website, www.spurbsherbs.com. And as usual, we have a good bibliography. Thank you.
Spurbs Herbs.
The proceeding was presented by Dr. Greg Sperber. We would like to thank Janelle for all her support and everybody else who contributed to this program.
Timothy Dobbins, Roger Campbell,